Hi students, family planning is an important part of your table viva, and today I am going to cover emergency contraceptive. So what are these emergency contraceptives? These are the contraceptives which are available for women to use post the coital act to prevent an unwanted pregnancy. So understand this, that emergency contraceptives are a backup method. They are effective only in the 95% of cases, with a failure rate of anywhere between 2 to 3% depending upon the method and the usage. Now, what are these types of emergency contraceptives? You have either hormonal contraceptives or mechanical emergency contraceptives. Before we go in the depth, let us understand the indications of these emergency contraceptives. These are to be used when the primary contraceptive method fails. That could be slippage of condom, that could be breakage of condom, that could be missing the combined oral contraceptive pills, or not taking your DMPA injection on the regular interval, so forth and so on. Now, understand these hormonal contraceptives. Primarily, the one which is recommended by WHO and which will be commonly kept on your table is your LNG, that is levonorgestrel emergency contraceptive. Common brands are iPill, Unwanted 72, or Pill 72. The dosage is 1.5 mg, either single dose or two doses of 0.75 mg taken 12 hours apart. Now, how does it prevent a pregnancy? It either inhibits ovulation, or it makes the endometrium thick, preventing ovulation, or it makes the cervical mucus thick. Now, if someone takes this pill and vomits in 2 hours, they're supposed to repeat the dose. Now, one thing that you need to understand it very clearly is that these hormonal emergency contraceptives that we spoke about should be taken within first 72 hours only. Beyond that, they are not going to act. The earlier a woman takes it after the coital acts, higher is the efficacy of the same. Now, if your examiner asks you, what if a woman comes to you post 72 hours? What are the emergency contraceptives that you can now advise? So the next one that I'm going to tell you is the one that you can advise up to 120 hours. So we spoke about iPill that can be taken within 72 hours. Now, ulipristal acetate, which is a progesterone receptor modulator, can be taken up to 120 hours. The dosage is 30 mg and it's prescription based. Next one is mifepristone, available in 200 microgram dosage. It can also be taken up to 120 hours. Going ahead to mechanical emergency contraceptives, copper T can also be inserted up to 120 hours, and it's the ideal candidate for it is the one who wants to continue copper T as the ongoing method of contraception. You can just insert it after up to 5 days, and then you don't need to remove it. That can continue being her method of contraceptive for for the period it is used for, up to 3 years, 5 years, so forth and so on. I hope you've understood emergency contraceptives and you'll be able to answer it during your table viva. Now, in case after taking emergency contraceptive, if a woman misses her periods, she's supposed to do an UPT. Please do go through the video about how to do an UPT present in the channel itself, and see her gynecologist irrespective of the result in the UPT.